Well, good morning, everyone, and thank you so much for being here. My name is Kathy Montgomery. I am the County Health Director with the Williamson County Health Department. We've just been out to showcase our Fairview Clinic earlier today, and today, right now, we're going to be showcasing our Franklin Clinic. I want to start by saying that we actually kind of started our renovation journey pre-COVID. Okay, so I'm going to kind of equate it to when a husband is married and his wife says that she wants to paint the living room. Okay, you know where I'm going with this. Then all of a sudden the furniture looks shabby, the curtains, and then before you know it, you spent a ton of money renovating that room, and then it just snowballs from there. Well, that's kind of how it started here at the health department. We started in a few exam rooms. We had a little bit of dollars and, stripped some wallpaper, painted some walls, and then all of a sudden it was like we're on a full-fledged journey for renovation. And I want to tell you, there's not 1 square inch of this health department that hasn't been touched in some way. Our building was built back in the 1980s. So I want you to picture with me just for a minute, chart racks in that administrative area filled with paper charts, okay? Thousands of paper charts before we went electronic. Burgundy tiled floors, okay? Peach and sage green wallpaper on the walls, okay? Groovy. It was a designer's nightmare, okay? So I say all this that we gathered ARPA funds, we gathered every state grant that we could. We used local direct funding and utilized every nickel of those dollars to renovate our clinics, okay? So on behalf of the health department, our employees, we want to say thank you to Commissioner Dunn, to the Tennessee Department of Health, to our mayor, and certainly to our county commissioners for supporting our efforts here at the health department. We are overwhelmed by your generosity, and thank you so much. I have to give a few shout outs as well, okay? First of all, I want to recognize Ashton and Jared from Wold Architects. They were the design team behind our clinic remodel, and they did an amazing, amazing job with what you had to work with, Ashton, okay? So we appreciate so much. I don't see John Campbell here. He was our general contractor. He was the construction manager for our project. He implemented the design that Ashton and Jared came up with, and he and I just have a kinship. I have to give props to Phoebe Riley and to Paul Webb for their help in managing our budget and making sure that we were on point all the time. To Leslie Mitchell, who is our purchasing agent for the county. Leslie held our hand through the bid process, through the purchasing process, and I'm telling you, we couldn't have done it without her. And then finally, big kudos, and please wave your hand, Andrea Hastings, because I have spoken numerous times about you. She managed our grants and our contracts for us, and let me tell you, this lady here is attention to detail, and she was on point with everything that we did, and I so appreciate you. You kept really great job. But I think the real heroes today are our health department team. Sometimes I can't hardly talk because I'm so proud. You went on this journey, and I tell you, this is a resilient team. And they demonstrate that resiliency every day whether we're doing a COVID operation, whether we're out doing fight flu vaccinations, or sitting in construction dust. We, in all the years that we've been doing construction on this, and especially during this particular phase, we never missed one day of operation in serving our clients. And one example, our administrative team, for example, had to sit in makeshift offices for 9 months or exam rooms, okay, to work and serve our clients, but we still did it. And so I appreciate you guys more than you know, and I'd like to ask everyone to please give them a hand. And without further ado, I'm going to turn it over to Mayor Anderson. Everybody's supposed to clap. You're sitting down.
Thanks, Kathy. The one acclimate that you did not say was yourself. To the commissioner, I would say we've got the best in the state right here. We've got a great team. Now, I do want to get off script just a little bit here. You mentioned the year 1980 this was built. That's really not that old. And for you that are looking at the work that we do here in the county through this, working with the state and through what Kathy and her team do every single day for our community, it's simply amazing. We're able to go in and look at zip codes, who's getting those services, and all zip codes are represented here, and we have a bunch of zip codes in Williamson County. So I know the message is getting out. I know the services are being rendered. And I know also in Williamson County, we have people that don't always have health insurance, and they need these services. And the public health portion of that is so important to our community in everything we do. We need to have a safe, healthy, well-working community. It needs to be well-oiled, as what we'd say back home on the farm, and you do that. Kathy did mention we have used ARPA funds and all this, but one of the folks in Nashville that's helped us is our State Representative Lee Reeves is here. Thank you for being here. I may have overlooked some folks. I want to say, as I'm introducing the Commissioner, Dr. Dunn, I know in this day and time that it's often hard to justify the cost of so many things, but I don't think the community's health and their well-being should ever be downplayed, even in a community such as Williamson County, where oftentimes people really feel that, why do you even need a public health department? But we do. Kathy, her team, many of these team members were with us during the COVID days, and we were knee-deep in dust out at the Ag Center. We were hitting shots on both sides of the cars as people drove through, and that could not have been done without good leadership. So I would ask you to take that back to the governor and let him know we greatly, greatly appreciate it. Did I forget somebody? You did. So, with that being said, thank you for traveling down from Nashville.
Yes, sir.
And going out to Fairview. Sorry I couldn't be with you earlier today. It's great to see you. Thanks for all the involvement that you're doing in making this a safer, better Williamson County.
Well, thanks, Mr. Mayor. My name is John Dunn, and want to just say greetings from Governor Lee. I know that we've been doing a lot of these visits where we've done remodeling or construction, but I know that the work that's been done in Fairview and here in Franklin is especially meaningful to the governor, and I know he'd be happy to be here if he could. So greetings and congratulations from Governor Lee. Kathy, I wanted to echo some thanks and thanks to you. First of all, Mr. Mayor, Representative Reeves, and I think our CHS team, can you guys raise your hand? Our Community Health Services team, Alan, Sanjana. Is Josh here also? He's lurking in the shadows. Josh has probably done a lot of miles doing a lot of these construction projects and so forth. So really appreciative of our team in Nashville that's been able to facilitate a lot of this work. If you work here at the health department, Kathy, you recognize him, but I couldn't see. Could you just raise your hand? And so a bunch of them hiding in the hallway back here. So
The number is still seeing patients.
the number seeing patients. So work goes on. So thank you guys so much for the work you do and for the service you provide to folks in your community. I think as the mayor said, we need that. We need those services in our communities, no matter really where you live. So really appreciate what you guys do every day and supporting public health. I'm a new commissioner, but I'm an old TDH employee. I've been around 20 years. Actually grew up in Nashville. I live in Williamson County, a little bit north of here in that other town with the B, starts with a B.
Bethesda.
No, it's a different one, different B. Maybe I should stop talking about it. My four kids went to school in Williamson County, and I'm proud to be a Williamson County resident too, and appreciate what the health departments do here for our citizens. I mentioned this this morning, but I remember coming out to the EMA complex when we had our first COVID case, and Kathy was there and Sanjana was there, and we really didn't know, what was going to happen, and we were announcing the first case in the state, and did some media interviews and so forth. And a few weeks later, Governor Lee was doing a press conference in the Capitol, and our commissioner at the time was on stage, and I was the state epidemiologist at the time, and I was on stage, and Governor Lee was talking about how it seemed very cloudy right now, but he was offering hope, saying that there was going to be a silver lining. We were going to see the sunshine again. And I think this project and these remodeling projects and the uses of the ARPA funding is some of that silver lining that we're seeing today. And it makes me really proud to think back to that time frame when we were all standing there doing this press conference and wondering what was going to happen, to fast forward to today and see, this great remodel here at the health department. So I think this is the silver lining. It's a clear day, and I think this is the silver lining. So I think, as I understand it, I think the ARPA funds were about $350,000, and the county put forward over, I think, $100,000, 116. So about a half $500,000 project to do these remodeling activities, and a great partnership. So thank you for that, everybody that was involved. I think the last thing I'll say at TDH, our mission is to protect, promote, and improve the health and well-being of all people in Tennessee. And we have some values that we talk about also: compassion, excellence, service, and trust. And I think especially for the staff here, that's what you guys, I think, exemplify are those values, because you're trusted in your community. You're obviously compassionate to the people that come in, that you serve, and you do excellent work. So thank you for that. And I'm ready to cut a ribbon. Are we going to cut a ribbon?
We're going to cut a ribbon, yes, sir.
All right.
Thanks, Dr.
Yeah,
Dunn.
thank you.
So let me tell you, this is what happens when you don't look at your speaking notes, but I'd like to ask Kevin Benson to come forward, please. Kevin Benson is over our property management, and he and Vince, I'm not kidding you. If I didn't have them to lean on for my project management, okay, all of our projects. So when I gave that little example, I was the wife in that scenario, and I think Kevin was the husband, okay? But Kevin, I never could have done this without you, and I am so appreciative. Thank you. All right. We're going to do a ribbon cutting outside. I would invite you, please, to visit our vendors that came today for our open house, and also enjoy some refreshments. And then we'll group and we'll actually meet up here, and we'll take you on a tour of our facility so you can see how beautiful it is. All right? Thank you. You ready? 3, 2, 1. All right, we're going to go this way. So we're going to talk a little bit about our services too as we walk, okay? Is dental still, they got a patient? Okay. We're going to start in the administrative area. All right. So if you can imagine, all these chart racks going this way. We've got so much great room, so much storage and everything here in our clinic. It's beautiful. We have all of our office assistants, and so they work up, check out patients. I'm going to kind of tell you a little bit about what they do as well. They do death and birth certificates up here. We do billing. They're a jack of all trades. I'm telling you, they really are the operations behind the clinic. So over here, we have our office supervisor's office. Y'all just continue to mingle around. You're in county building. Y'all can do whatever. We've got great dedicated space for our copier and storage over here, which before our vital records clerk was right there. So every time somebody came up to make a copy, of course, naturally you're going to start having discussions, being friendly, but I'm sure it deterred her work a little bit. But so we have 7 stations actually set up, but we are overwhelmed by the look. And to promote some privacy for our patients and so forth, we actually frosted our glass so that patients can't look over and be able to see other screens and things. We're trying to be HIPAA compliant, protect. So anyway, so we're going to keep on walking. I'll take you through dental when they don't have a patient, okay? But you can see, and we also expanded the amount of space that the office assistants had. So it's a little bit deeper for them so that they have lots of capacity. Say hello, Yolanda. How many years, Yolanda? 23 years that she's been with our clinic. She's also an interpreter as well. And then we have Brenda Jones. Brenda Jones, 32. 31 years. I mean, we have some great longevity here at this clinic. It's amazing.
Thank you both.
Yes. All right, we're going to keep on going. We're going to go down medical. Hey, first we're stopping at the bathrooms, okay? Because y'all are going to see my lobby bathrooms. I ain't kidding. They are spectacular. Truly. Todd, you don't have to go in the men's room, but listen, this was sage green and peach, and the floor was retro tile, and look how beautiful it is.
Beautiful.
Yes, it sort of looks like emergency management.
Yeah, it's
right?
pretty.
And they laid that subway tile over the existing tile that we had, so they didn't have to rip all that stuff out.
Yeah.
But I love it. It's so beautiful.
It is. It looks really nice.
My team always laughs at me because they say she always has to show off the bathroom. Heck yeah, the bathroom's awesome. All right. Obviously, our little kids' play area that we have over here. I'm going to take y'all through the pharmacy, to the drug room.
Where did y'all get the marker?
Oh, let me tell you about that. Do you know about that?
No. I
Okay.
loved it.
So if you're affiliated or know anything about Brightstone, Brightstone actually offers services for adults with special needs, and they actually painted our artwork for us years ago for both Franklin and Fairview, and so we framed the artwork. They signed it, everything, and it's just so special to us. It's so special. Cute.
You want to pick me up, you go over there. We went over there.
I love
It is
Brightstone.
the best.
They have the best services, don't they?
Yes.
Come on back. So we're going to go this way, okay? Because we did just do a remodel of our drug room and our vaccine room, okay?
Yeah.
I'll wait till everybody gets in here. Come on, come on. So we utilized grant dollars for this renovation, a different grant for this renovation. I told y'all we've been under construction for years. So we remodeled this drug room. So just as an FYI, for any of our patients, and they have to be Williamson County patients, any of our patients that are uninsured or maybe their insurance doesn't cover the cost of medications and so forth, we can prescribe those drugs out of our drug room, okay? If they walk in off the street with an application or with a prescription from Mercy or any other clinic, they can't be filled here. They do have to be our patient, but we have contracts with different pharmaceutical companies. So we have everything from diabetes meds, high blood pressure, we've got glucometers that we can dispense, we've got family planning, every type of birth control known to man, and so a lot of good options for patients. If we don't have the drug that they need, we can write the prescription and go through GoodRx or other low cost prescription companies and so forth, okay? So this used to be our drug room, and this was an office, and across the hall over here was our vaccine room, and across the hall over here was where we kept our diabetes supplies. So when we think about efficiency of our nurses and trying to travel from one place to another, we just said, we're gonna knock out this wall. So see, that's where, HGTV comes into play a little bit, okay? We're gonna knock out this wall and we're gonna put our vaccine in here. So it makes it all encompassing. All of our diabetes supplies are here. And then we just turn the vaccine room into an office. So we'll go out that door right there. Come on through. I will tell you that we do not do controlled substances here at this health department or in Fairview, so we don't have the threat of folks coming through. Guess we should have gone the other way because we're going to hit them. This is our lab that we have. This is Yolanda. So she works up all of our patients, or she draws labs, does weights, heights, everything for our patients for both WIC and primary care and general. You're on Candy Camera. Now you are. All right. We're going to scoot on by, and then I'll talk about this room. So we have, y'all could lead this tour. Shoot, you've been here enough. We have 5 exam rooms on this side and a treatment room, and we have a new x-ray unit that just got installed yesterday, so we're still painting up this room and so forth. Now, we only use this x-ray room for our TB patients. We don't do ortho or anything like that here at this clinic, okay? But for TB patients, this is where we do our x-rays and so forth. We remodeled this nurses station probably about 6 years ago. So that was after we painted exam rooms. This was our second labor of love, okay? We have a treatment room here, so for our providers to do pap smears, do IUDs, things like that for our patients. We also have 3 negative pressure rooms here at the clinic. So if we have a patient that comes in that might potentially have TB or, back when Ebola was big. You remember those days, Christy? So we would bring patients in, and the negative pressure room is just not ventilated to other parts of the health department. It's just self-contained in that particular room. So we've got mainly offices back here and supplies. We have a disease intervention specialist. You guys remember back when COVID was going on, we had that person that did all that contact tracing. We had a team of people. But Tiffany typically does all of our contact tracing for any STD. Help me here.
You said STD and pointed at me.
No, for STDs, gastro, any type of potential outbreak in our community. She does the contact tracing to reach out to individuals who may have been exposed to get them in for testing and treatment. So. All right, so mainly all of these are all staff offices and stuff. And then we have another 6 exam rooms or 5 exam rooms on this side as well. So we did have a full-time provider. Unfortunately, he just left us last Friday, so we're in the process of finding another physician. We do have a nurse practitioner that works 3 days a week here and 2 days a week in Fairview. But we also have a physician and a nurse practitioner that rotate through our clinic and a pediatrician that comes once a week. So we have a lot of services that we make available for our patients. We do STD testing, all immunizations, adult physicals, like I said, family planning. We have a really high Spanish-speaking population in our Franklin clinic. So we have 3 full-time medical interpreters. 2 of them function as administrative folks, and then we have another bilingual staff member as well. So try to provide that coverage. I'm going to introduce you to Dr. Moeller, our dentist.
Dr. Moeller, literally.
Literally.
Spring Hill High School.
We'll be in here in a minute. Come on.
And I'm 2 minutes from Spring Hill High School.
We'll go out here and go to dental.
Oh, yeah.
I think they just wrapped up with the patient. All right. So this is our dental clinic. We offer, until everybody gets in here. So come on in.
Dr. Muller's coming.
Yeah, good. So we offer dental services for both adults and children. He does usually, come on in, Dr. Moeller.
Punch down.
You can tell them what you do here at the clinic.
All right. Well, we just extracted some teeth on a person, but we do. We see primarily children, uninsured care, adult emergencies. We provide comprehensive care for adults, basic dental services, so extractions, fillings, cleanings, those kind of things. See patients from not just Williamson County, but all over the place. We have 2 treatment rooms here. They're kind of mirror images of one another. So once you've seen one, you've seen the other. But it works out nicely. We have our X-ray unit and everything, moves from side to side. So that we have capability to do everything. One thing serves 2 treatment rooms. Sterilization and our pan machine to take an X-ray that goes all the way around your head and takes all your teeth at once. Sit in the back, but that's basically the only thing that's back there. So this is our whole clinic, and it's myself and Tony, my assistant's back there. Or is she back there? No. Okay. So it's just the 2 of us back here.
So one of the things I want to say is we are really fortunate to have Dr. Moeller because he has been with us 13
just about
13 years now.
Yeah.
And Tony's been here probably,
Longer.
a lot longer.
Yeah.
About 18.
Yes.
Yeah. So we have, like I said, great longevity among our employees. And so, Alan, I'm just going to tell you, Dr. Muller's one request is he would love to have a window.
Yeah,
If we can
we've been
make that
trying for
happen.
13 years.
We have, and we have not been successful. So,
Yeah,
See
well,
what
if
we
I
can
step
do.
outside, I can look out the door. And
Yeah,
see the
that's
outside
right.
Just to make sure I know. what
That's
season it
right.
is. Yeah.
but he is phenomenal, and his patients love him. And we're so blessed to really have Dr. Muller with us for so long.
Thank you.
So,
Kat.
thank you.
Appreciate it. Yeah.
Appreciate you. I think you got another crew coming in, okay? You're popular right now. All right.
Sneaky.
What?
Just sneaking around.
I know. Well, I'm trying to stay out of everybody's way. All right, we're almost done. We're just going to go down this hall. And is Byron still with us? Byron, I wanted to show you. So this is not, I don't want to show you this, but I want to show you the office next door, okay? So we have our WIC kitchen. We call it our WIC kitchen just because everybody, historically has always called it that, okay? Come on in. It's just because it's on the WIC hall, all right? So we do, other than a lot of our employee lunches and hooplas and so forth, we actually, our health educators are through that door right there. They're usually out at schools and so forth. But they do work with UT Extension and other partners to do taste testing, maybe low carb diabetes cooking. And so they'll do things like that, events, educational type events in our kitchen.
Volunteer for taste testing.
Absolutely. I will keep that in mind, Zanny. We have two health educators that y'all might have been aware of, Bella and Caroline. Bella just had her baby a couple of weeks ago. She did.
She comes and sees us.
She does, yes. Tell the crew what she does for you guys.
Well, we have what we used to call a tobacco docket, which has turned into a vaping docket. But she comes with
Caroline.
and right after a tobacco court, they set up and they do about a 30-45 minute presentation every month about the effects of vaping for the children and the parents. So it's been a great addition to our court.
So, and that they're out in schools, they're doing STD. You talk, I mean, it's soup to nuts. It's A to Z what they can present on. And so anytime you guys have got lots of great educational items. So anytime you guys are looking for something related to health, please reach out to us because we're more than happy to come over, send them over to help you out. We have an overflow office here that Byron and his group are getting ready to utilize some of this space because the region's getting ready to go through their construction phase. So, and we are in the process right now of hopefully converting that back space. You can look right here. To a little workout area because we've been utilizing our conference room and our conference room's gotten too small for when we have our all-team meetings. So we're going to be using, is your battery down? We're going to be using surplus from Parks and Rec. Those great partnerships. That's what I'm saying. Volunteer behavioral health has been providing services in our health department for about 4 years now. We're going on 4 years, really about 3.5. But they utilize 3 of our rooms plus the lab and this lab right here. So I just want to say that they provide services for uninsured and TennCare patients. So it's kind of a natural win-win for them to be able to refer patients to us and us to be able to refer to them. Warm handoff, they can get them assessed, get them an appointment, sometimes same day. So it's been a great partnership with them. We don't work their patients up, we don't schedule their patients, nor do they ours. It's just they utilize space in our facility. Okay. And then back here, I will tell you I am working on one more little project. We have our breastfeeding room, so our mother's room. So we really promote breastfeeding through our WIC. We do WIC services, which is Women, Infant, and Children, okay? They've moved away a long time ago from the old voucher system where you had to tear off a voucher and go to the store, and, you know, the stigma of that alone was not good. And they moved several years ago to an EBT card. So now our moms can get their benefits loaded on that EBT card like a debit card. They put all their groceries up on the conveyor belt. They swipe their WIC card first, and anything that's WIC approved will come off the top, and then they just put in their regular debit card to pay for the rest of their groceries. I mean, it's wonderful. It keeps women on WIC longer. And the reason why we like that is because that allows us an opportunity to get moms into family planning to make sure their children are immunized or need dental services and things like that. So it gives us opportunity to continue to refer for those programs and services too. All right. This is our WIC dietitian, Stephanie. And then back here, say hello, Stephanie. All right. My office, and then I see, hi. We're just doing a tour of our facility. If you'll just, you're from behavioral, if you'll introduce yourself. Yeah.
Sure. Hi, I'm Dr. Ron Newerding. I work for Volunteer Behavioral Health, and we lease out some of the space here to do evaluations for the county courts. Primarily Williamson, but also Jason, Marie, and 5 other counties in the area.
So he's here every other Thursday or once Thursday a month? Yeah. So this is my next project is our conference room before I leave, okay? But don't tell anybody yet. I guess I just did, didn't I? And back here is our employee kitchen, and around the corner is our CHANT coordinator. So CHANT stands for Community Health and Navigation in Tennessee. They operate like social workers. They're not technically social workers, but if we have families that come in, or maybe we get calls from not even patients, from residents who might be having difficulty paying their rent, paying their utility bill, or maybe they're co-sleeping with their child and they need pack and play or a car seat. We have a free car seat program here at the health department. So just remember that if you ever have the need for car seats, they can come here and get a car seat regardless of income and so forth. But these people kind of help to navigate those individuals through resources to try to help them with whatever their needs are, whether it's food insecurity, whatever. They can help to navigate them to resources. So they are like priceless and so needed in our community. So, and that ends our tour. So do y'all have any questions? And hope you were able to kind of check out the beautiful surroundings. And
It's great.
thank
Really
you.
good job.
Thank you.
It's beautiful.
It really is, and I'm just super proud, and
Yeah. It should be. It should be
we're super
amazing.
tired too, Alan. Act like I did all the work. Didn't lift a finger, but Phoebe, thank you so much. I appreciate your crew, just really staying on top of that budget for us. And there were times that I had to call Phoebe and go, "Oh, how we doing, Phoebe?" Because the last thing you want to do is overspend. But anyway, you cut that off.